I'm going to talk about a few different topics. Where we've gone wrong in healthcare, why a lot of physicians sadly regret going into medicine, and my own personal story as well. So a few somber topics, but very important we talk about these issues. I remember when I was a little boy, my childhood dream was to become an airline pilot. I was crazy about planes. My dad, who worked at the nearby airport, Heathrow Airport in London, used to arrange for me to go to the airport to meet people. Whenever we would fly anywhere, I would go into the cockpit and sit down and meet the pilots. And that was all a great experience, tremendously positive and made me want to go into that field. Then, when I was an early teenager, I switched and decided that I wanted to be a vet. And I remember when I was maybe about 14, 15, I did my work experience at a local vet hospital. And that seemed like a good career as well, where I could work with animals and cure them. Then, when I was 16 years old, my uncle, who I was very close to, tragically got diagnosed with metastatic prostate cancer. And I remember how crushed I was when I received the news because I was very close to him and really, really had many happy memories with him coming to visit us, and we would go and visit him. And he went on a downward spiral and ended up passing away in just a few weeks. His cancer was so advanced. And I remember his first symptom was that he woke up with difficulty walking, and the cancer had already spread to his spine. So that experience made me want to go into medicine. And from then on, medical school it was. So at that time, like a lot of people who decide they want to go into medicine, I started getting more work experience at doctors' offices and hospitals. I started watching more medical shows, and I remember seeing these hero doctors on TV, these fierce patient advocates, these highly knowledgeable people who were basically like heroes during the day. And I thought to myself, what better thing to be, what better career to go into? So I applied to medical school, and I ended up being accepted into Cardiff University, which is a city about 2 hours west of where we lived. And medical school was a terrific experience. It whizzed by really fast. You were super busy, exam after exam. You made new friends. You were away from home for the first time. And before you know it, you're a doctor. Most people who go into medicine go in with very altruistic reasons. We have what's called the altruism gene. Studies have been done which have shown that over 3/4 of medical students have chosen the profession simply because they want to help people and do some good in the world. It's not about prestige, it's not about money, it's about helping people. So you have these medical students who graduate with still very high ideals. So I remember I graduated, I worked in the local healthcare system and then came to the United States and did my residency in Baltimore. And I, again, was blessed to be with a very interesting group of residents who we were all great friends and learnt a lot during residency. We then graduated and everyone went their separate ways, and I was very excited to become an attending doctor. And typically as an attending physician for the first time, you're earning a good salary, you're very busy, and it's another steep learning curve. Remember, medical education, you finish one thing and then straight away another career ladder starts. So as an attending doctor, and this phenomenon exists in all specialties, many doctors now are working for 2 or 3 years and then finding that they kind of hit a wall. And they realize that medicine was not what they expected. Being a doctor was not what they had imagined. There are many reasons for why this feeling is escalating at the moment. But essentially, over the last 30 years, we have had a perfect storm of factors come together. The first is that there has been a radical shift in healthcare in the United States, away from small group and solo practice towards big corporations. Medicine 20 years ago used to be about good old Dr. Johnson's office around the corner that would serve you and your whole family. That doctor would be known to everyone in the community and would take care of everyone. This has now become a rarity. In fact, really doesn't exist at all. Now, because of regulations, it is very difficult for small group practitioners and small practices to exist. It's far more favorable as a doctor to enter into practice employed by a big corporation. I know myself, my goal was to one day have my own practice and essentially be my own boss, small business owner. But that is virtually impossible at the moment. And I'll talk more about this in a moment. Then, over the last couple of decades, we have had an explosion in the number of administrators in medicine. There have been charts and graphics that have been circulated online which have really shown this in very eye-popping detail. Charts which show that over the last 30 years, the number of physicians has basically stayed static, and remember this at a time of an aging population and increased need for doctors, whereas the number of healthcare administrators has gone up several thousand%. So for every physician you now have interacting with a patient, you will have 10 or 20 administrators as well involved in that process. So it doesn't take a genius to see that if we're talking escalating healthcare costs, that is a big reason why costs are spiraling out of control. A third factor in why medicine has become so different is information technology. I'm going to be careful here because I don't want to sound like some sort of technophobe. Technology is the future in all areas of our life, but something very interesting and unique happened in healthcare. Around 10 years ago, when we suffered with the Great Recession and the economy crashed around 2008, we all remember the federal stimulus package which was signed. And attached to that was $30 to $40 billion to basically computerize the US healthcare industry and bring it into the 21st century. So there were some noble intentions, but there were regulations attached to this and penalties involved for small clinics and hospitals that didn't comply. So they was having to spend huge amounts of money to get IT into hospitals and clinics in a rapid amount of time. And unlike technology in other aspects of our lives, for instance, our smartphones, which we all love, or our tablet devices, the technology which has been rolled out in hospitals was done way too fast before it had had time to evolve. The technology was not ready for prime time. So as a result, physicians were left with suboptimal, clunky, and inefficient technology that was taking more time away from patients. There have been studies done that have shown that new physicians, interns, are now spending as little as 10% of their day in direct patient care. 10%, with the majority of the rest in front of computers. I myself have seen doctors round for an hour in the morning having human interactions with patients and then sit for 10 to 11 hours at a computer screen doing all of the associated administrative work. I personally think this is a disaster for the practice of good bedside medicine and good communication with patients and their families. So when you combine all of these factors with other issues as well, let's face it, I mean, medico-legal issues have been there for some time, falling reimbursements at a time when the squeeze is on in healthcare, all of these things have really taken their toll. And you can do your own research online. Just put it into Google, physician burnout, and see what comes up, because we are facing a true epidemic at the moment. Statistics suggest that over 50% of all doctors are burnt out and dissatisfied with their jobs and are looking for ways out of medicine. Such a shame for a job which is so important to society and one where you had an awesome bunch of people go into the profession 20 years earlier who really wanted to do it. Check out some of those statistics. They vary by specialty, of course, but they are truly alarming. So on my travels, I've worked up and down the East Coast. I have met thousands of doctors, and my own conclusion, and not to put too much of a downer on things, but I feel like it's very difficult to be a happily employed full-time physician. Because as an employee, sooner or later, something will happen which will make you unhappy in your job. It could be a directive from the C-suite. It could be another administrative requirement, but something will unfold that will eventually irk a physician off. And remember, doctors are among the most well-educated, intelligent, and many of them are very creative. And the marriage, as I call it, between healthcare and big corporate medicine is not an easy one, to put it mildly. So on my travels, I've broadly seen 3 categories of happy physicians. The first would be physicians who are in an academic setting. They're in a university setting. And I have the greatest of respect for these physicians, but they are in an academic bubble. Remember, 90% of all care in the United States is delivered in the community. Physicians in academic centers are often shielded from a lot of the administrative requirements. They have a lot of help from medical students, interns, and residents. They have taken a salary sacrifice and give credit for that, but how they practice is not how, quote unquote, physicians in full-time clinical practice are going about their daily jobs. The second group would be physicians who are actually in clinical practice but working towards something else. I'm always a bit saddened. I go to a lot of networking events in Boston and other cities as well, and I meet a lot of young, starry-eyed medical students who, when you ask them what they want to do, and I tell them that we really need good physicians at the front line, they tell me that they're doing MBAs or hospital management courses because their goal is to get out of medicine, clinical practice, as soon as possible. So after all that training, they are going to leave, and they're telling me this at earlier stages of their career, and that's not what our healthcare system needs. The third group of physicians would be those doctors who have decided that they're not going to work as a full-time employee. They're going to do part-time work, per diem work, moonlighting work, with or without other creative ventures at the side, but essentially they're going to create their own schedule. Frequently they earn more and work less, and they're very savvy about how they do that. As a result, they're not tied to one particular institution and feel a sense of freedom and more autonomy. Myself, I am in that latter group, I would say. I took the decision after a few years in clinical practice that it was very difficult to be a full-time employed physician for one entity. So I chose to be credentialed in different hospitals and do different types of work. I still maintain an anchor in one hospital. I think that's always good. But I create my own schedule, and I really do enjoy working like that because I feel it takes me away from a lot of the administrative headaches and gives me a sense of freedom. And remember that other physicians are doing this as well. And for most specialties, especially the generalist specialties, doctors can be savvy and take advantage of the supply-demand mismatch to do something like this. There is a high demand for physicians, and doctors have a skill which is really needed. So I would like to finish up by talking about a painting that truly inspires me every time I look at it. The painting is called The Doctor. The year was 1890, and it was Victorian England. There was, of course, no television, no internet, no mass media. And Sir Henry Tate, who later founded the Tate Gallery — I hope some of you have been to London and been to the Tate Gallery — he commissioned a painting, and he asked a famous artist at the time by the name of Luke Fields to paint a painting of significance, and he gave him license to paint whatever he wanted as long as it would be a good painting. And Luke Fields chose to depict a scene from his life that had left a huge mark on him. And tragically, a few years earlier, in 1877, Luke Fields' infant son had tragically passed away. The doctor at the time was called Dr. Murray, and he laid attentive vigil at his son's bedside. And his character and demeanor left such a huge impression on Luke Fields that he never forgot it for the rest of his life. And that was the scene that he depicted. The painting went on to tour England, where it became a sensation. There's a report that somebody was so overwhelmed when they looked at the painting that they actually died on the spot. It was then reprinted in America, where it sold over 1 million copies. Why was that painting so popular? At the heart of the matter is the fact that it depicts medicine at its purest. The simple, caring physician, honest, and completely devoted to their patient, the human connection within medicine. That painting has become an icon because it serves to remind us, even now, of what medicine should be like and what it is all about, always. I always think to myself, what would this painting look like now? Would it show a doctor anxiously staring at their computer screen? Would it even be called the doctor? Would it be called the provider? We don't know, but it gives us all pause for thought. Ladies and gentlemen, I sincerely hope that physicians can take back medicine and maintain the ideals to which we first entered medical school. Thank you very much.